In today's video, we're diving into a therapy from the behaviorist approach known as systematic desensitization. This is a treatment commonly used to help people overcome phobias. This video will focus on the main components of the therapy, so let's break it down. First, what's the aim of systematic desensitization? The aim is simple: to gradually help a person reduce their anxiety or fear response to a phobic stimulus. It's all about helping the client feel more relaxed and comfortable in the presence of something that used to scare them, whether that's spiders, heights, or even flying. There are three main components to systematic desensitization: relaxation techniques, the construction of an anxiety hierarchy, and exposure to the phobic stimulus. The first step is teaching the client relaxation techniques. The idea here is that you can't be both anxious and relaxed at the same time. This is called reciprocal inhibition. So, if the client can learn how to relax their body and mind, they'll be better equipped to manage their fear when they face it. Relaxation techniques often include things like deep breathing, progressive muscle relaxation, or even meditation. These techniques help reduce the physical symptoms of anxiety, like a racing heart or tense muscles. Once the client has learned how to relax, the next step is to build something called an anxiety hierarchy. This is a list of situations involving the phobic stimulus, ordered from least to most anxiety-provoking. For example, if someone has a fear of dogs, their hierarchy might start with looking at a picture of a dog, then watching a dog from a distance, and eventually working their way up to actually petting one. Each level represents a different degree of exposure to the fear. Now comes the exposure phase. The client is gradually exposed to the phobic stimulus, starting from the least frightening item on their hierarchy and working their way up. The goal is to stay relaxed while facing each step before moving on to the next one. There are two types of exposure: in vivo and in vitro. In vivo means real-life exposure, like being in the same room as a dog. In vitro, on the other hand, is where the client imagines the scenario instead of physically being in it. The therapist works with the client to choose the best approach for them. So, how do we know if the therapy has worked? The goal is for the client to eventually reach the top of their anxiety hierarchy while remaining calm. Success is measured by their ability to face the phobic stimulus with little to no anxiety. When the client can stay relaxed, even at the highest level of exposure, like petting a dog in our example, we know the therapy has been successful. Let's run through a quick example of how this might work in practice. Say someone has a fear of heights. First, they learn how to relax using deep breathing. Then, they build their anxiety hierarchy. At the bottom might be standing on a step stool, followed by climbing a ladder, and at the top, standing at the edge of a balcony. Using systematic desensitization, they would be exposed to each of these situations step by step. They might start by just imagining themselves on a ladder while practicing relaxation, and eventually they would face the real thing in vivo, standing on a ladder in real life, all while staying calm. That's systematic desensitization in a nutshell. It's a step-by-step process aimed at reducing anxiety in a structured, controlled way. And for many people, it can be an incredibly effective way to overcome fears. Thanks for watching. Make sure to like and subscribe for more psychology content.